Welcome to Marrow Masters Season 10, sponsored by Pharmacyclics & Janssen and Insight. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplant from diagnosis through survivorship. Season 10 focuses on sharing hope and inspiration regarding chronic graft-versus-host disease, or cGVHD. This season will cover the importance of clinical trials, find out what survivors wish they and their loved ones had known before, during, and after transplant, and even talk about the unique needs of young adults. Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Today we welcome Dr. Andy Harris of Memorial Sloan Kettering Cancer Center in New York. Dr. Harris is unique in that he is not only helping young cancer patients receive a transplant, but he himself is also a bone marrow transplant survivor. So hello, Dr. Harris. Thank you so much for being with us today.
Hi, Peggy. Thank you so much for having me on today. It's a real joy to be here.
So, Dr. Harris, before we talk about the unique needs of young people dealing with graft-versus-host disease and the hope and inspiration that we're going to provide today, I would love if you could tell us a bit about your transplant experience.
Sure. So I was a 19-year-old through a year and a half of college studying biology and pre-medicine. Back in 1998, I was playing semi-professional soccer, best shape of my life. And over the spans of winter break, I went from being able to run miles just nonstop to having to stop to catch my breath walking across campus with my backpack. That led to blood work that diagnosed me with acute myeloid leukemia. And given our proximity to the University of Michigan, I was transferred up there for my care. Unfortunately, my chemotherapy did not touch my cancer in the first couple of rounds. We had to go to some more experimental therapies to get me into remission, and then I required a bone marrow transplant, which I received from my sister in May of that year. So we're coming on 25 years at the end of this month.
Wow.
And unfortunately, afterwards, I did experience graft-versus-host disease of my liver. It didn't respond to steroids, so I had to get therapies. We had a lot of very limited options back then, but thankfully we were able to get it back under control. Then over the next 2 to 3 years, I had frequent visits while I was in my studies. I was able to come off of all my immunosuppression. I graduated college in 2001, went on to med school, from there to residency and fellowship, and I've been doing bone marrow transplantation for 12 years now after training.
Well, if that isn't a calling, I don't know what is. Thank you for all that you do. So, Dr. Harris, you work with youngsters. They're such a unique demographic. Let's talk about their lives imploding when they find out they need to have a transplant, and how do they handle missing out on things. They need to go to the hospital for a transplant. They may get graft-versus-host disease. Phew, let's get started.
Yeah. So obviously, as you can imagine, depending on the age of the kiddo, there's different things that they're supposed to be doing at that age. And in infants, they're supposed to be bonding with their parents, getting to know the world as a safe place, things like that. And then we give them these treatments where they're feeling miserable, having pain, having nausea. And so that's very disruptive, to their development at that stage. For our toddlers and other young children, they're supposed to be starting preschool, daycare, something along those lines, where they're starting to socialize a bit, learn to interact with their playmates and their peers. And that goes on through high school when we encounter some new challenges. Teenagers are just a challenge to begin with, I can say, as a parent of 3 of them. But what they're supposed to be doing is establishing their identity separate from their family, identifying a peer group. Who are they as a person outside of their nuclear family? So all of this, when a patient has to come into the hospital for a period of time, get isolated from their peers, take time away from school or for work for our young adults that we also see, it's a huge disruption to that. And it can lead to a lot of anger, and it certainly leads to some stunning in that development. For some of our patients, there's a big challenge in catching up with their peers on those things. And after going through a transplant, something that's more life-threatening, it changes your perspective on the world a bit. And sometimes it can be hard even just to communicate and connect with their peers again when they come back to school and start resuming the development and the other things they're supposed to be doing. So it can be very challenging. It can lead to some resentment. It can lead to frustration, depression. But for other patients, amazingly, they kind of get right back into the swing of things. They've got very supportive peer groups. And there are patients that are out there thriving and living their best lives after their transplants as well. And it can be anywhere on that spectrum for each patient.
Dr. Harris, let's talk about what patients are missing out on when life is going on and they're not there and then they're trying to get back to it.
I think this is a bigger issue for our adolescents, our tweens, our adolescents, and our young adults, and for the younger patients, because there's a lot of first and big time events for those patients. We're talking things like school dances they'll not be able to go back and participate in because they've missed out on them. Going with their friends to either participate in or cheer on big sporting events and having the memories going from a quick road trip to cheer on your high school football team at an away game, going to homecoming after homecoming game, things like that. But there's also weddings, there's graduations. There's a lot of things that they miss out on when they have to isolate for their transplant, either because they're in the hospital or because they're not quite ready to be out and about amongst a lot of people just yet. On top of that, when they're taking this pause on their life, their school, their work, wherever it is that they are, is constantly evolving as well. So children are moving in or moving out. People are joining and leaving the company that they're working at. People are getting promoted. And while they're away and dealing with very scary and very real health issues, this whole dynamic is changing. So when they return back, even if they stay in the same class or they go back to the same job, what they go back to may not look like quite what they remembered. And that takes some adjustment as well. There's a lot of missing out. There's a lot of change that happens that they're not able to participate in that takes additional adjustment for them when they get back into things.
Absolutely. Thank you for that. So let's talk more about special accommodations that are needed for this age group at the stage that they're at.
Sure. Depending on what the patient goes through for their cancer or blood disorder or immune disorder in their transplant, what complications they've had, some people will need some additional assistance to get back into their activities that they need to be doing to move on with their life. So all of our patients have follow-up appointments that they need to take. So that's time away from school, time away from work, time away from activities. For some of our patients that have difficulty with mobility, either because of chronic graft versus host disease or bone health issues from steroid exposure, things like that, they need extra accommodations in school to get from one class to the other, whether it's in an elementary school, high school, or on a bigger college campus. Some patients may even benefit from a wheelchair or other motorized mobility to help them get from classes to other classes in a meaningful time span. In addition, especially for children in school, many of these patients take medications where they'll have a daytime dose that they'll have to take during those school time hours. So they need to be able to work with the school nurses, and the nurses need to be comfortable with the medications and in dealing with and interacting with a child that's had a bone marrow transplant, which can be somewhat intimidating to a lot of people in a lot of these different fields. And then we start talking about other things like, are they having chronic graft versus host disease of the eyes? Do they need to limit their screen time so they have to break up their homework if they're doing their homework electronically? Do they need to sit closer in the classroom to be able to see the board better? Do they need downtime just to let their eyes rest or other things like that? For those that are having skin issues, they often need to apply medications during the day that are topical to their skin. They need a place that's safe where they can do that privately and with appropriate supervision if they're a younger child, things like that. And then when we talk about physical activity, gym class, sports, things like that, depending on what issues a patient may or may not be having, whether it's lung chronic graft versus host disease, limited mobility, deconditioning, bone health issues, we may need to work with the school in order to find the appropriate accommodations to let them participate and have a meaningful participation without setting false expectations for them. So that's something that the bone marrow transplant team often has to work with the schools in order to make sure that we set them up for success when they go back, as opposed to setting them up with a lot of insurmountable tasks that just leads to further frustration, further isolation.
Yeah, so they are really challenged here. They're definitely getting back into the swing of things, a rhythm, if you will, with their classmates and their work and their homework and just trying to feel normal again. Let's talk more about maybe even returning part-time versus full-time in the beginning.
Yeah, so that's a very good question and something that we have to talk about with each patient. Each patient, when they're getting ready to get back out into the world, is in their own place as far as their conditioning and what things they're currently dealing with, what things they've been through. So I think it sometimes has to be a very blunt conversation about what is realistic for that patient to do when they're getting back into work or getting back into school. Some families and some patients, I think, are ready to go back full time and they're ready to go full bore, and they may not feel that way. And sometimes they think that they're ready to go full at it and they're just not ready yet. So I think for a lot of patients, it's not a bad idea to start part-time back just to kind of get the feel for things, get back into that pace, but at a limited amount of time. So that way they have time to recover, time to reflect on how they're doing, see if they are really successful, really flourishing in that environment or not. And after they go back, they really need to take that time and ask themselves, how is this going? Am I really doing as well as I'd like to be doing or I expect myself to be doing? And if they're not, Why is that? What are those barriers to me really succeeding and enjoying myself and doing these things? And these are conversations that should be an ongoing thing with their physician, because they may be related to symptoms or an issue that they may even not realize that they have. Or there are medications or services or physical therapy and other things like that that can be used to optimize their ability to participate in things that they want to participate in.
So Dr. Harris, what if they're just not ready to go back, or they're not right where they hope to be? This season is going to be about hope and inspiration, and even just the whole one day at a time, and realizing that it's going to take a while to feel good again and acclimated to your school, or your, even as a young adult, going back to work.
Yeah, no, that absolutely happens. And sometimes a patient's not ready to go back. Sometimes they're emotionally just not ready to return. And so we have to take time for that and address those concerns and what's holding them back emotionally. But there are other patients that want to be back. They want to be doing these things, but just physically, they're just not capable to do it just yet. And that can be extremely frustrating, as I'm sure you can understand. But taking a little bit of extra time away if they're not ready, it actually is a very good thing for them. If you go back to school before you're ready, particularly when you get into, say, college, and you go back and you get poor grades, those would stay on that record, and then it's hard to play catch-up back on those and then try to improve your GPA, things like that, when you're looking for jobs or secondary education, things along those lines. For those that are already in the workforce, going back and really not being ready to fully perform their duties to the best of their ability. Now, this is after we factor in any limitations that need to be accommodated, of course. But if they're going there and they're not performing up to what is expected of them, this may also be harmful to their professional career trajectories, their opportunities for promotions, things like that. So sometimes taking that pause when we realize we're not quite where we should be, doing a little bit extra recovery, working actively on these things, getting all the appropriate tests done. Sometimes we have to do neuropsychiatric testing to make sure there's no cognitive concerns, things like that need to be accommodated as well. By taking that time off like that, getting yourself to where you're in a place where you can fully do those things, you're setting yourself up to succeed. That's really what we want for all of our patients, is really to understand what they can do, what they want to do, how to help them get there, and how to make sure that they have every chance to succeed.
For sure.
And obviously, the things that they can be doing during that time frame are making responsible choices, getting good sleep, eating well, getting physical activity, avoiding some of the high-risk behaviors that we know a lot of our teenagers get into, whether or not they've gone through a transplant. We know that our cancer survivors and transplant survivors are at increased risk for risk-taking behaviors, substance abuse, alcohol use, smoking, things like that. So trying to avoid those things, knowing that they are going to ultimately hinder you both in the short term and the long term, are all really important things to help our patients getting back to where they really hope to be.
I couldn't agree more. We hosted a program recently with a young adult who talked about the importance of socializing, the social outreach, the groups on Facebook, finding your tribe, finding your people that can really relate to what you're going through. And there was a woman at the end of the program who just cried and said, "You don't even know how much this means to me to learn about all these groups that are there for young adults." And we'll list those in the show notes. But I guess I always think about, I have 3 myself, and they're young adults, the socialization, and how do they work around those challenges, post-transplant?
Yeah, we did touch on this just a little bit earlier in the podcast, but this is a real big struggle for a lot of our kids. And I think the older they are, the more challenging it can be up until they get into their adulthood, like mid-20s. Their peer group that they had before they had to take the time away from transplant, those kiddos are still going on and doing all the things they're going to be doing. Our patients very unfairly miss all that. They take this time away to deal with a very scary health issue that's potentially, fatal, and they hear about all these risks and they have to process all these risks and internalize these risks. And so it leads to challenges sometimes with what was their peer group, their friend group beforehand, and then getting back into connecting with them because they're dealing with what's the current thing going on with Taylor Swift, who's she dating, who's she broken up with, and you're dealing with, I need to remember to take my stairs tonight because I'm worried about a GVHD flare. Those are very different priorities that they have, and sometimes that can lead to a disconnect with their peer groups. So these online groups and other support groups for our patients with people their age that are going through similar things, I think gives them a sense of normalcy, a sense of belonging, and understanding that they're not the only ones that have had to go through this. And that it's okay to be struggling with these things because these are very normal things to struggle with at those age groups. Now, on top of just developmentally from a social standpoint being in a different place, there's other issues that our patients struggle with. There's body image issues. So, for gals that have lost their hair, may not have grown it back the way they liked, or may not have grown back as much as they'd like. Same for the guys. That can be very challenging and can be a very traumatic thing to have to deal with. Wearing a wig is something that a lot of our patients choose to do, but I also have many of them that say, I can't wait to come home at the end of the day and take that wig off because it's hot and it's uncomfortable. But it makes me feel more normal, and it keeps my peers, my friends, from looking at me and having a constant reminder of this thing that I had to go through. On top of that, there are changes that happen from going on steroids, whether it's the weight gain and the acne, things like that. If they have chronic graft-versus-host disease affecting their eyes or their skin, those are things, rashes and tightened skin, things like that are things that can be very clear and evident and prominent that can be seen by their peer groups that may lead to some sense of fragility from their friends, that they think about not including them in things that they're worried about them, things like that. And so sometimes friends become more protective than the patients want them to be, or sometimes they unintentionally exclude them because they just think that they're not going to be able to do those things. And additionally, teenagers, there's not a lot of forethought. There's a lot of spontaneity, not always for the best. And they may not understand the unique needs that each patient has that's gone through a transplant. It's very uncommon that a child has the opportunity to have that discussion with their friends in a way that their friends are going to be able to get that. So that can be very challenging for them. Additionally, if they have another complication that puts them back in the hospital, that again disrupts their ability to kind of reintegrate in with peers and with friends and things like that. And so there's another pause button and another chance for them that where they were catching up, they're starting to fall a little bit behind even further than where they were while they're trying so actively to catch up. So it can be really challenging. And that's not even getting into romantic relationships, sexual health, sexual identity, and all those other issues that our adolescents and our young adults are dealing with as well, because those are all very real issues for our patients too.
Absolutely. Should we talk a little bit perhaps about the relationship at home with the parents? A lot of times at this point, of course, pediatrics, patients are living home. They are under the care of their parents, their caregivers. But sometimes for young adults, they just maybe got their first apartment. They're in a place where they're not home, but they're not really on their own. They need mom and dad again. What do you think about that?
Yeah, that's a real struggle. That was one that I actually really struck a chord with me. I was through a year and a half of college. I was out on my own. And I got sick, and then so I moved back in with my parents after my hospitalization. And there was a lot of conflict there because, and I understand my parents' point of view much more now as a parent. As a parent, you want to take care of, you want to protect your child at all costs. And to see them go through something like this and your sense of helplessness and having to watch them go through this without being able to do a lot for them, aside from making sure they take their medications and go to sleep, is a very traumatic thing for them. And so when you've got this child that's been establishing their independence that all of a sudden is now dependent on you, for lack of a better term, they dig their claws back in and go back into this mama bear protective mode that sometimes can really further hinder that social development and catch up that these teenagers and these young adults want to do. So there's struggles on both sides. There's the teenagers and the adults that are wanting to get back out there, wanting to start finding that independence again, starting to redefine themselves back separate from their family. And you've got these parents that are just terrified that something bad's going to happen to their kid and don't want to let them out of their sight. As you can imagine, that can lead to a lot of conflict, a lot of arguments between them. This is a very normal thing and something that a lot of our families struggle with. It's something that I struggled with my parents and something that we still talk about from time to time. And I think we're still talking through some of the impact that had on our dynamic together. Again, this is normal. But when it comes up, if you're finding that there's a lot of stress on the family dynamic, on the parent and child dynamic, there's an opportunity to talk about that with your doctors. There are a whole slew of people at the hospital that work with the transplant team to make sure that patients and their caregivers are taken care of, especially when they're not being particularly kind to each other. Sometimes counseling can help. Sometimes medications are necessary for one or the other because of the trauma of having to go through a transplant. And although that happens for some families, it doesn't happen for all. We realize this is a life-changing experience for everybody that's involved. It's not just the patient. It's not just the parent that gets affected by this. Everybody gets affected by this. And there's no judgment now as a transplant provider. There's no judgment on our part. We understand that this is tough and different people are able to process things in different ways. And some people need more help than others, and that's okay. But if you don't let us know that you're having these struggles, if you don't let us know that you're needing this help, sometimes we just flat out miss it unless we hear, hey, this is a thing and it's something that's really stressful for us and we need to figure out a way to make this better. And then we will be there right alongside you, figuring out how best to navigate that together.
I'm just thinking about how much your patients must appreciate your insight, having walked this walk. It must be so wonderful to have you as their doctor. You can talk from experience, and that is just really special, I would imagine, and helpful.
I think it can actually be a little bit of a double-edged sword. One of the things I had to learn early in my medical training is not to expect that all my patients are going to have the same experience and the same outcome that I have.
True.
I always tell people, aside from my initial diagnosis and that graft versus host disease I dealt with early post-transplant, I've been extremely fortunate.
Mm-hmm.
I was able to get myself fully back to school. I was able to go back and play sports at a very high competitive level. I pursued my dream and fulfilled my promise to my doctors and went back and worked with them to make this better. I was... my wife and I were extremely surprised, somewhat shocked, and my family a little bit alarmed initially when we found out we were expecting children, because I was told that was not going to be a possibility for us. And I know for a lot of my patients, some of these things are things that they're not going to be able to experience in the traditional way. But there are a lot of ways to navigate things. There are a lot of ways to address some of these limitations they may have and still lead to a very fulfilling life, still be able to find a lot of joy in life, and still be able to have challenges to help you grow and keep you directed and focused. So when I talk with my families, I often don't bring up that I had a transplant. I mean, it's out there on the news, it's out there on the web if people want to find it, and they can bring it up to me and we can talk about it. But when a patient comes to me for a transplant, I'm there to take care of them. And the only time that I will volunteer that information to them is if it's something that after I've double and triple checked myself internally, that it's something that they absolutely need to hear to see that there is potential light at the end of the tunnel. I can't promise them that what they're going to go on and do after transplant is going to look like what I did, but I can promise them that no matter which twists and turns their transplant journey takes, that I'm going to be with them every step of the way and help them any way that I can. And that's really the biggest promise that I can give them. When we do these transplants, there's no guarantees aside from that it's going to be scary.
Yeah.
And we're here to help shoulder that burden and help smooth over those fears, or when we're scared too, to talk about how we're going to address things and then how we move forward with it. Whether it's trying a new experimental therapy or whether we're refocusing our goals for our care, things like that. These are parts of the journey for some patients, as sad as it can be. But the relationship that we have with our patients, the trust that they put into us, I don't think there's a relationship quite like it anywhere else in the whole field of medicine. It really is special.
I have heard that time and time again, Dr. Harris. I believe you. Wow. So as we start to wrap things up, what else do we want to cover? The new normal, what it looks like. I think you've covered some of that, but is there anything else you'd like to say about their moving forward, their future?
Yes. So, what's frustrating for patients is even after we get through our transplant, if we're able to get off of all of our medications, we still have long-term risks from whatever disease it was that we were transplanted for and from the transplant itself. A lot of our patients have lifelong risk for secondary cancers, either due to chemotherapy, radiation, GVHD affecting the skin or the mouth. For those that needed high doses of steroids for longer periods of time, there are bone health issues. There's osteoporosis, the concern for joint health because of the steroids. For patients that have had radiation or have chronic eye GVHD, there's eye health concerns, cataracts, need for long-term specialized lenses, things like that. And risk for thyroid and other endocrine and hormonal issues. And what those additional risks are for each patient is going to be unique to each patient based on their treatments, their diagnosis, their transplant, and what happened after their transplant. I know most transplant centers have a survivorship program, and I think it's very important for all of our patients, particularly our younger patients, as they get older and start to work towards that independence again, or need to move on to their own independence, to talk about a survivorship plan as far as follow-up and what that should look like for them, to make sure that we're aware of what those risks are and we're watching for them so we can catch them early if they come up and address them before they become bigger problems or have a larger impact on our lives. A transplant in of itself is disruptive enough, but knowing that there are these things that may come up later is really, really unfair, but it's a reality that our patients face.
Absolutely. So we covered a lot today. You've given us so much inspiration already. But I'm going to ask you one more time, some of the hope and inspiration that you can offer our listeners.
Even though every single patient's journey through transplant and beyond is unique, they're not alone. There are other people that are dealing with similar issues, that have had similar things come up with their families, with their work, with their school. And those peer groups can be really important for that sense of belonging, sense of this is okay for a lot of families. So if you find yourself struggling with this sense of isolation, and then certainly the pandemic's only taken that sense of isolation and made that worse for everybody, our patients in particular who wanted to get back into the world had to put that on hold even longer as we were dealing with this terrible viral pandemic. But between these peer groups that have had shared experiences like this, for some patients, just getting themselves back out there and reconnecting with old friends and then kind of finding that new normal for that relationship just as much as they're finding their new normal for themselves, people do move on. People do move on from being somebody that's surviving and after having had a transplant to being a transplant survivor to being somebody that had a transplant. Mm-hmm. And that is a process that takes a different amount of time for a lot of people. For some people, it happens over a couple years. For some people, it happens a couple decades. Everybody goes at their own pace, and that's okay. But know that there are people out there that care about you, that want to help you when you're struggling, and if there are things with which you really just can't seem to get on top of yourself.
Oh, thank you, Dr. Harris. You know, at the National Bone Marrow Transplant Link, we have peer support. We have a licensed social worker who mentors folks and provides a buddy, if you will. And that has been real successful. And, you know, since the pandemic, we've taken on the challenge of the isolation and we were doing more interactive programming. We're doing book clubs now and coffee clutches. So people have the chance to talk with people who understand where they're coming from. Just want to tell you real quick about one of my favorite young podcasters, what she said recently. And I think it really resonates with what we're talking about today. She said, live now versus waiting for health. Don't wait to get back to normal before meeting your needs for connection, activities, and engagement in life. Normal may not return, no matter how much you want to get back to your old life. Accept what it is, experience pleasure, ask questions, live deeply and joyfully every day. Claim your best life as the life you are able to live right now.
That is a really beautiful sentiment, and I couldn't say it any better myself. And so I think what this person's really talking about is getting out there, because finding the new normal is in and of itself a journey. And you won't be able to find out what you can do, what you enjoy doing, and what things you need to tweak a little bit in order to get that joy. And I think that's really what they're talking about. And I think that's absolutely beautiful.
Oh, thank you so much. And thank you for being with us today. We'll include lots of information in the show notes about your center and resources for young adults and anything else that you might want me to include. Thank you.
My pleasure. It's been an absolute joy being with you. And hopefully this can help somebody out there. I think that's why we all do this, is we know that there are people out there that are thriving. There are others that are struggling a little bit, and we all want to help and do what we can.
Well, you sure did today, and I got a feeling it'll be more than one person. So thank you so much.
Oh, it's my pleasure, and thanks for having me.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or follow the link in our show notes.